So hi, welcome to an update on how my knee surgery went last week. It's now day 10 of recovery and things are all going well. I had a stage 2 knee revision, so they drilled pins into my upper and lower leg, and then they attached a knee joint with a hinge in the middle. The reason for the hinge in the middle is because it's a much more significant operation, because there's already work been done, that the hinge has to give them stability, and it allows them to move that knee back and forward so that when they came to the quad tendon repair, they had a little bit more flexibility in terms of where my knee would actually be sitting. Now that all went well. I had an allograft, an Achilles allograft as well. They took a bone graft from a donor with an Achilles attached, and they reattached it to my upper shin, stretched the tendon over the top of my existing tendons, and then attached it about midway up my thigh. And speaking to the surgeon after the operation, things all went to plan. So I'm now in recovery. I have a knee brace on for the next 8 weeks, locked at 0 degrees, so I've got no flexion in it at all. I have to do little or no physio on it other than trying to get my knee straight again. And after that, they'll then progressively take the physio a little stage further, and they'll introduce a little bit of a 20-degree bend every couple of weeks after that. So as far as the operation went, I was on a spinal epidural and general anaesthetic. The reason for both of them was that the operation was going to take quite a bit of time. So actually in theatre, in surgery, it was about 3 hours. But from start to finish, going into resus and going into anaesthesia before that, it's probably about 5 hours that I was out for. And the reason that they put you in general anaesthetic for that is that the spinal epidural is expected not to last that length of time. So it's better that you're still under in case you wake up mid-surgery. So it all went well. I was fast asleep for it. And when I woke up, there wasn't much pain at all. They had me on a spinal epidural for the next 4 days after that. And what I would say is, if any of you are going on to spinal epidural, take as much pain relief as you can. But what I found was that as the pain progressed in the early stages, I would hit my little button every 15 minutes that I was allowed to give myself another shot of anaesthesia. Now, you think at the beginning of that when you hit it, you're still quite sore and you continue to hit the button, but what it does have is a numbing effect on your leg, and that was probably the most uncomfortable thing that I had. I didn't have much pain, but I had this really odd feeling from a numb foot. This is how my knee's looking after surgery. I've got this brace on just now. I've got it unclipped here at the moment because I've got a lot of fluid sitting in this part here, and I think part of that is to do with the straps being done up all the time. So I've been icing this continually and pretty much keep my legs straight as much as possible. Because of the allograft and the tendon that's been repaired in here, I need to take my time with this and make sure that recovers well. This is where the failure is likely to happen. So they've put the bone graft in down here, just at the top of my shin, and they've stretched the Achilles tendon over the top, and they've joined it round about this section here with a lot of stitching up into my quad muscle. So this is where the whole thing will fail. And there's another major risk of infection because we've got a donor Achilles in here and a new knee. Then it's increased the chances of infection. So I've had to take antibiotics again. I'll be on them for the next couple of weeks, 4 times a day with 2 different types of antibiotics. But to be fair, it's a lot of medication to be on, but I'm feeling okay. I'm doing all right. The knee brace, I had one of these before. This is a Donjoy X-Rom, and the last time I had one of these on, there's 2 different models of it. This is a slightly older one, but it is a better version. The newer one gave my knee too much flex. During post-recovery from the last time I had my knee operated on, I was able to bend my knee too much, and that might have been a consideration on part of the failure. So I was quite concerned that this was going to be the same, but at the moment it seems to be doing all right. I suppose it's just spending time after they've put it on to make sure that your knee's not flexing too much. And it's got adjustability in here. I can flick one of these red buttons and suddenly bend my leg, but that's 12 weeks down the line at the moment. It's locked out at 0 degrees, both in flexion and extension, and it's really just keeping it that way for the next 8 weeks. I can engage my quad muscles very lightly. I don't want to put too much pressure on this repair here. So I'm just taking my time and just lightly capillarizing it, I suppose. I have got a complex machine, and I was very tempted to put it on today just to get some blood flow around about here. But I think I'll wait until these staples come out. They're coming out on 2-3 days time. And once they're out, then I'll give it another few days to recover, and then I'll maybe start to capillarize with the complex machine. I don't want to put too much strain on this part of the muscle, so the complex machine is really just pulsing through the muscle just to get some blood flowing into it, and that should hopefully help the repair. So that's me for the next 8 weeks. I've got this brace on and no flexion in it. I have to sleep with it on 24/7, so it is quite difficult to sleep. And other than my last operation, I've now got a scar running from just over the back of that plaster there all the way up to the top of my thigh. But what I have noticed is that this time round, they didn't have to go so high in my thighs. So this scar has now been opened and lengthened. This was the 4th time it had been opened. This part was the last operation I had in January, and it seems to have been healing quite well. So despite the fact that it's been opened a few times, the scar is actually looking quite good considering that. And it will just be a matter of time. Once the staples come out and it's fully healed, there's no broken skin, then I can start to rub some cream into that to try and break that scar tissue down. That's another important part of your recovery, is getting that right. But I'm on crutches. I've got crutches now for probably the next 4 months at least, and I'm partial weight bearing now. In terms of my mobility has improved dramatically since the last 12 weeks. After I had my first stage revision, it was touch weight bearing only. So you're basically balancing on your good leg. I don't really have a good leg as such because of the work that was done on this one last year, but the touch weight bearing is purely just being able to put your toe down just to give you that little bit of stability. So you're almost kind of hopping on your crutches, and it's incredibly tiring. Now I'm able to put partial weight bearing on, so I'm using the crutches to take the weight off of the left leg, and I'm using my right leg back to normal again. So hopefully that should help to strengthen the right leg again. And you'd be surprised how much of that power or strength that you have in one leg starts to degrade when it's not getting used properly. So all that work I'd done on my right leg, I was pretty much back to square one again in the ability to be able to sit to stand. I was having to push off quite hard with both hands, and then a lot of effort to get on to stretch that leg out, where prior to my surgery in January, I was able to do one-legged sit to stands quite easily. I'm getting there now, so I'm getting back to it, and the ability to put this left leg down on the ground now and walk in a more natural gait is going to assist in strengthening both legs. But I haven't really been out that much in the last week or 10 days because I'm giving this repair time to knit together the stitching to bind into the muscle. And once I've had my staples out, then I'll get back into doing some walking, and I hope to cover some nice scenic routes as I'm recovering. Hopefully get back into some photography again. That's probably the biggest thing that I've missed since I've been through this process. But anyway, bye for now, and thank you for checking in again. Please like and subscribe. It does help the channel. And although this is a knee surgery recovery channel at the moment, it will progress into being back into being a travel channel again for Scotland. I am desperate to get out onto that west coast and do something, even just to look at the scenery and smell that nice fresh sea air. But anyway, bye for now. Like and subscribe, and I'll see you in the next one.